My name is Dr. Hannah Strom, and I'm a pelvic floor physical therapist in Woodbury, Minnesota. I'm going to be diving into how to perform perineal massage on yourself at home to prepare for a successful vaginal delivery. So you might be asking yourself, what is perineal massage? So perineal massage is a type of massage that can be done at the opening of the vagina here to prepare for a vaginal delivery. You have muscles called your pelvic floor muscles that surround that vaginal opening and the anal opening, and also are a little bit deeper inside of your pelvic bowl. And what we can do to prepare the body for a vaginal delivery and reduce the likelihood of perineal injuries or tears at these muscles is to do massage at the vaginal opening and at these tissues. What we're trying to prevent with perineal massage are grade 3 and 4 perineal tears. What that means is preventing an injury or a tear down through these muscles all the way to that anal sphincter or through that anal sphincter. So we can perform this type of massage as a prevention technique and to get the body ready for a vaginal delivery. Before getting started with perineal massage, you'll just want to make sure that you are cleared by your OBGYN or childbirth provider to make sure that you are safe to go ahead and do this at home. If you're working with a pelvic floor physical therapist, which I highly recommend, they can teach you how to do this technique safely and properly on your own and perform this in the clinic. So first step is you'll want to make sure to wash your hands thoroughly and have clean hands ready to go. You'll also want to make sure that you have a lubrication to use for this technique. We like Good Clean Love or Uber Lube at our clinic. From there, make sure that you find a comfortable position to do your perineal massage. Some women like to do this in the bathtub, in the shower, or laying semi-reclined in their bed. So once you've found that comfortable position, we'll go ahead and locate the vaginal opening. You'll use a thumb or 1 or 2 fingers with some lubrication on your fingers, and you'll simply insert those fingers into that vaginal opening. And we're thinking about stretching at this lower half circle part of that vaginal opening. So from 3 o'clock to 9 o'clock if this was a clock face. Once you insert your fingers about an inch, inch and a half, you can go ahead and start by stretching down towards what's called the perineal body, this group of muscle right between the vaginal opening and the anus, stretching down and holding, making sure that you can breathe as you feel a moderate stretch. Then we can start to move to one side, again using that thumb, 1 or 2 fingers to stretch off to the side, and again off to the side. We like to teach our patients to start with some gentle stretching from 3 o'clock all the way to 9 o'clock. Continue to do that several times in a row for each point on the clock. And then we can go ahead and find more of a movement or moving massage down and back all the way from 3 o'clock to 9 o'clock, sustaining that moderate pressure and that moderate stretch. One other option that you have, if using a thumb, 2 fingers, or 1 finger is not comfortable for you, you can use a device called a pelvic wand to help you, since it can be hard to reach this tissue in this area. So if you're using a pelvic wand, you want to make sure that you clean the wand thoroughly and apply some lubrication to the end of the wand. We're only inserting that wand about an inch, inch and a half into that vaginal opening. You'll do the same exact technique, starting down at that 6 o'clock and gently working that wand all the way across those different points on the clock, and then doing some sweeping massage while applying that stretch and pressure. So there you have it. That is perineal massage. One other thing we like to educate our patients on is that this can be a great technique to start around 34 or 35 weeks of pregnancy. Again, you'll just want to make sure that you get clearance from your birth provider or doctor. And we typically will recommend doing this technique about 3 times a week, starting at that 34 or 35 weeks. Again, this can be such a great technique to prepare for childbirth, reduce the likelihood of those higher grade perineal tears or perineal injuries. And if you have any questions, please feel free to reach out to us, check out our website, or contact us for more information.